Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Living with congestive heart failure. Introduction. Congestive heart failure, also known as chronic heart failure, is a common condition that affects millions of people every year. It is possible to control congestive heart failure. If not successfully controlled, heart failure can cause serious disability and death. This program explains congestive heart failure. It covers how to manage your medications and how to help control congestive heart failure through lifestyle changes. Heart failure. The heart is responsible for pumping blood to all of the organs in the body. It is a muscle that is expected to work continuously, without rest, for a lifetime. Heart failure is a condition where the heart is not able to pump blood to the rest of the body at a normal rate. When the heart cannot pump all the blood it receives, excess fluid could back up into the lungs and other parts of the body. The lack of blood being supplied to the body, in addition to the buildup of fluids, causes symptoms of heart failure. When fluids collect in the lungs, it is called congestion. That is why this disease is called congestive heart failure. If not controlled, congestive heart failure can make it hard to do simple activities, such as walking or eating. Leaving the healthcare facility. You need to understand the recommendations your healthcare provider makes. These recommendations may include diet and fluid restrictions, finding the activity level that is right for you, weighing yourself daily, taking medications. Other recommendations help you to know what to do if your symptoms get worse, when to have follow-up appointments. Following your discharge instructions will help you manage your heart failure more effectively. Share your discharge instructions with your primary healthcare provider. Make sure to give his or her name and address to the healthcare providers you saw in the healthcare facility. Ask them to send a discharge summary to your primary healthcare provider. Call your healthcare provider if you experience increased swelling of your feet, legs, or abdomen, shortness of breath, sudden weight gain, the need for more pillows, or the need to sleep in a recliner. Call your healthcare provider if you experience a cough that does not go away, an irregular heart rate, any problems with heart failure medications, new or worsening dizziness, waking from sleep to catch your breath. Ask someone to drive you to the emergency room or call 911 if you experience severe shortness of breath, coughing up pink and frothy sputum, chest discomfort, pain or pressure not relieved by rest or nitroglycerin. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Treatment with medication. Your healthcare provider will base your treatment on the type of heart failure you have, how severe it is, and your response to certain medicines. Tell your healthcare provider about any medication you are currently taking, including non-prescription medications, vitamins, or dietary supplements. This way, your healthcare provider can prescribe the best combination of medications to treat your heart failure. Your healthcare provider will explain the possible side effects of the prescribed medication. Your healthcare provider should be notified if any side effects are noticed. When picking up a new medication, ask to speak with the pharmacist. Learn the name and dose of each medication you take. Also, know the reason for taking each medication. Make a simple chart for your medications. Update your chart as the medications change, especially if you have been in the hospital. Set a regular routine for taking medications, such as at mealtime or bedtime. Do not skip doses. If you do miss a dose, do not take 2 doses at once. Set an alarm on your watch to remind you to take your medications. Use a pill box to help you organize your daily medications. Lifestyle changes. Your healthcare provider may recommend a reduced sodium diet. Talk with your healthcare provider about how much sodium is right for you. Try to be as active as possible, but stay within what your health condition allows. Talk to your healthcare provider about the type of activities you can do. Heart failure usually affects the ideal level of activity for most patients. Lose weight if you are overweight. Check with your healthcare provider about the resources available to help you lose weight, including dietitians, health education materials, weight loss classes. Eat a healthy, balanced diet that is rich in fiber and low in fat and salt. Check your blood pressure regularly. If it is high, keep it under control by avoiding foods that are high in salt and taking prescribed medication. Do not smoke. Check with your healthcare provider about available resources to help you quit smoking. Check and control your cholesterol and blood sugar levels. Having a heart condition can make you more likely to get severely ill from COVID-19. Check with your healthcare provider about staying current on your COVID-19, flu, and other vaccines. Do not use illegal drugs and avoid alcohol. Get enough sleep at night and rest frequently. Manage stress in your life. Ask your healthcare providers about resources that are available to manage stress. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Congestive heart failure, also known as chronic heart failure, is a condition where the heart is not able to pump blood to the rest of the body at a normal rate. It is a serious disease. If not controlled, it can lead to disability and sometimes death. The lack of blood being supplied to the body, in addition to the buildup of fluids, causes symptoms of heart failure. When fluids collect in the lungs, it is called congestion. That is why this disease is called congestive heart failure. Thanks to advances in medicine, healthcare providers can help patients control heart failure. For most patients, treatment consists of taking medications and adopting healthier life habits. You need to understand the recommendations your healthcare provider makes. These recommendations may include diet and fluid restrictions, finding the activity level that is right for you, weighing yourself daily, taking medications. For a lot of patients, taking daily medication is important in controlling heart failure. Medication should be taken as prescribed, and any side effects should be reported immediately to the healthcare provider. There are many steps you can take to stay healthy. Eating well and exercising are both important. Avoid illegal drugs, alcohol, and smoking. Your healthcare providers are available to help you select lifestyle changes that fit your needs. Thank you for using Explain.